We'll be fine.
Wow, great. Welcome. Thank you. We're gonna go ahead and call the Legislative Policy Committee meeting order at 3:04. Can I go ahead and get a motion to approve the agenda?
So moved.
Second. All those in favor?
Aye.
Aye. Okay. Been approved. Next item, meeting
You
minutes.
want some?
I just need to clean the glasses, but that's
Oh,
okay.
no, those are hands.
1 second, sorry, second.
All those in favor?
Aye.
Well, I was good. I had a little plot for that maybe she.
My glasses.
Okay. So. All those in favor? Did we?
Yeah, we said that.
All right.
We got that out.
Aye.
For the minutes. Okay. Great, if you need this.
No, thank you, thank you.
So public comments at this time, comments from the audience may be made on items not listed on the agenda that are of public interest and within subject matter jurisdiction of the district. The committee has a policy of limiting speakers to no more than 3 minutes. The committee cannot take action on items not listed in the agenda. Public input may be offered on an agenda item when it comes up for discussion and or action. Are there any public comments?
There are none, but just so you know, Director Smith is listening in, as this is her first time on the board, so just listening on the committee meetings. And Dr. Kumar was able to join us. He wasn't sure if he was able to join us or not, but he is here.
Oh, great.
Hi, Dr. Kumar.
Hi, Dr.
Welcome to
Kumar.
both of you. Thanks for joining.
Thank you. Welcome,
Director Smith.
Dr. Smith.
So, item E, old business, we have AB 2019. There is a memo, a report from Donna. Donna, would you like to guide us or give us some of your highlights and, on the report? And we'll open up for questions we might have.
What I did was basically, as you can see, I gave you the background of
Mhm.
why this came about and, how you directed us to, look and see what we could bring this forward for discussion and review. What was the original intent of the author, and then Tish was talking about working on setting up a meeting with her, so I don't know where that's at, but, these were some of the things that one bullet research on the changes, but, we'll just discuss with the committee, talking about what are the ramifications, where does it work? So then more of the history of the AB 2019, and I'm going to give you a little bit of the author's statement of reasons why, and really some practices did change because of AB 2019. I went from an informal to a formal process on grant practices. It has reduced private influence. I think some greater oversight and standardization. I find it very convenient with our own grantees because they understand that we can't just go out and solicit, and if they do ask, well, do you think I can apply for this program for this much money? And she's like, just fill out the application, and then once you send it in, and then that's the whole process. And we actually have a whole grants team, as you well know, that we review them internally, and then we meet with the grantee. And today we met with the LGBT center, and oh my God, it was just amazing the stuff that they do, that this doesn't come either out in the grant application or they're just the best people. Why in the world would they
Yeah.
do? They've got this pipeline of therapists and they're just churning out. It's absolutely amazing. So in that respect, I find it convenient, so I don't have to put myself in a position, have to say something to anybody.
Mhm.
But, so I know.
You could just tell them it's not me.
Yeah,
It's a
it's the
state.
law,
Yeah.
yeah, it's the law. So then I also, looked at some things about, some specific interests or challenges about the bill itself. And it does ensure an equitable process, prevents undue influence. So I think the law itself is a good law, maybe, but I know that there were some concerns, and I don't know if ACHD has changed those concerns, but when they first came out in 2018, an analysis that was prepared by Angela Mapp, they're basically, the ACHD was saying, why are you singling out healthcare districts
Mhm.
when you've got a lot of special districts, water, air, like all kinds of things, so why are you just singling out healthcare districts? So,
Do you know if that question was answered?
no, it wasn't. And I have a feeling that it was because of maybe one or two specific healthcare district board
Mhm.
members that were actually doing the
Yeah,
private
I
solicitation
know.
stuff. So,
Okay.
So what they call it, one bad apple spoils the whole bunch.
Mhm.
Mhm.
Um. So then we are in compliance with our own grants policy. We do have technical assistance, and then so the last page is basically maybe some continuation for next steps, what we can do. Maybe expand on the definition, what I mean by technical assistance. If you go look at the federal regulations for technical assistance, they're a lot more like talking about concepts and give a lot more information, a lot more give and take when you're working with the feds on a federal grant and asking for help on what technical assistance means. The other one was just following up with setting up a meeting with IUR Curry. I guess we could follow up on the concerns that were expressed by ACHD and whether those are still an issue.
Mhm.
And then these are a list of the healthcare districts that actually adopted them and have them in their grant policies on their websites. So, maybe contacting them, just say, how's it working for you? Are you having challenges? And maybe instead of just one healthcare district like us going to the Agua
Mhm.
Carry, just finding out. Kind of like almost like not a committee, but like an ad hoc committee or something
Mhm.
like with these other healthcare districts.
Yeah.
And say, okay, what are you finding the challenges, the barriers, or none at all?
Mhm.
And then Chris had put in about uh, oh, I put about the OP, we might have to revise maybe a little bit of our OP5, our own policy. And then Chris had added about possibly exploring language to incorporate in the bill. We have to do that, about initial discussion of what concepts of collaboration, not so much getting into the weeds of can we apply for 100,000? It's more just the concept. Kind of in a way, stick to the high priorities, look at the strategies in the performance measurement, and so.
Yeah, in a way to be able to kind of open that up a little bit more to where it's not so restrictive where you can't speak with them at all prior to the grant application. If there's possibilities to do that, but in my communications with Tish, she had asked for us to see if we could come up with some possible language that she could propose to the author. So she's kind of waiting for that, see if we have something we'd like to propose. Because it is very, very restrictive, specifically in that language that's on page 9 of the packet, but it's of the actual bill that I highlighted. It specifically says it's appropriate for prohibition against individual meeting and grant applications. So, I mean, it's very direct and very specific that there can't be any meetings, prior to the grant application process that we have defined in our actual policy. So we've done everything that aligns appropriately with what's included in the bill. I mean, we have our annual budget, we have our grant process and our grant policy, et cetera, that's on our website, and we practice it, et cetera. It's the limitation that we can't specifically talk to organizations, even in concept. We can't even talk to them prior to applying for a grant. And from my understanding, is we shouldn't even be saying, hey, we know you could get a grant, just go apply on our website. I mean, we shouldn't even be doing that under this current language. So if there's a way possibly that we could, and to back up a little bit too, so, I've been involved with the ACHD, currently on the board, but also consistently meeting monthly with certain selected CEOs. All CEOs are allowed to participate in the CEO roundtable, but not all of them do, but several of them are on that meeting. And I've asked this question several times, and not all of the districts, and that's why Donna has specified specific ones that are doing grant funding, because not all of them do grant funding. They operate hospitals, et cetera. And, I think that the thing that sets us apart is that we have a much larger grant budget and funding available for grants where many of the districts do not. They have much smaller grant programs, and so I don't think they're impacted as much with the prohibition with this as we are. And so they don't, at least the ones that I've talked to, don't seem to have a real problem with it. And also I talked more with Kathy Martin, the CEO at ACHD too, and she said that, you know, most of the districts have adopted their policies and they seem to be working for them, but she does understand that it's, you know, it creates limitations when we're, you know, trying to award monies to organizations to further support our vision and mission. So, I mean, I think maybe if we could, you know, if there's other thoughts coming from the committee for potential language that we could incorporate into either revised bill, or if we could have a little more flexibility in our actual policy to maybe discuss, you know, concepts without, but it's a fine line.
You know, because when I read that number 5, I mean, you could interpret it that we're not allowed to discuss. So it says a prohibition against individual meetings regarding grant applications. So I could read that as that if somebody had an application in, that we're not allowed to discuss it with them. But is there interpretation there where before they even submitted an application, could we discuss, to your point, Chris, the concept?
Yeah, I mean,
So maybe getting
if we could
clarification
get
on that.
clarification enough.
Because-
But I think that's where some of it, and I'm sorry, and I'll finish and then let you go. That I think that's probably what's potentially happened in the past, is that it's crossed over from discussing concepts to actually getting more into the scope of work and
Right.
talking about, you know, this dollar amount and that sort of thing. And then, you know, with like a specific grantee. And I think that's where our RFP process really works well, because we're not going to one specific
Right.
grantee
Right.
and putting out a broader message. So,
So what I was gonna say is how I see it, right? All this, I think what. So if we see it, it says, outside of the district established grant awards process. So for me is they're okay, right? Like just make sure that you're within your own, grants process. And so I'm thinking, do we just go back and modify our policy? Of course, right, we're not gonna not respect what the rest of the bill says, but then also like, that's how I interpret it, right? Like, as long as if you as a board establish your grants, awards process, and you already said like, that's what we're gonna respect, like, that's what you have to follow. Like, that's how I read
Yeah.
this. So like, if we were to tweak our grants award process to maybe give us a little bit more flexibility, as long as we don't, you know, go against the other provisions of the bill or the law in general, I think that maybe we would be good. I also, like and appreciate the next steps, and I mean, if you ask me, right, I'm excited if we can run a bill, and this would be, right, when we would do it. So it would be, you know, even something before our next committee meeting. So, I also want to know your thoughts on like the next steps, and yeah, if we want to either just like clarification on that specific provision of the bill, or if we're cool if Jeff says, yeah, as long as you follow your own grants process, and then we internally work on it to align a little bit better or help us work with or communicate with our grantees or those interested. But I also believe that some of the other points, I think they're very good and valid, and that we should still reach out to, for example, other healthcare districts, and that we can do through ACHD. Of
which I
course,
do.
yeah, but like an actual meeting, if we wanna like meet and form a little like a coalition or support coalition for it. And then, yeah, I know think Tish mentioned that she had reached out to Aguirre Curry's office. I think that out of respect, because she was the original person that author on the bill, that we check in with her and see if she would like to run any modifications. If not, I think that our next step would be, one, we start looking and creating language, and with like this information, Tish should also be able to help us and guide us on that, and then look for an author. And I would suggest that we start with our local legislators. If you know, I hear Curry doesn't want to carry it, I think that would be our next step, would be go with one of, let me see, two, three, one, two, three, four of our local legislators that we could potentially ask. They are gonna ask for more information and maybe some like sample language, but I think even if we have like a brief fact sheet on it as well, and then just propose it and see if they'll pick it up. And this would be the time to do it.
What do you
Yeah.
think about, before we even look at that, let me go a little bit more in depth, I can bring back forward what the feds mean by technical assistance. Because they actually apply, apply for grant, or they're thinking of applying for a federal grant, they can go to a technical assistance department, the technical assistance department, and they work with them on the grant now. That's interesting that, the feds can do that, but here we are restricted as a healthcare district, that's something that we can't.
Well, is technical assistance more after they have applied? for
Yeah,
grant?
it's before they.
Even
apply.
before they apply.
Even before.
So we need to have a description, I would say, a meeting. With, what construes a meeting? Because is a phone conversation a meeting? Is me handing out my business card and saying, go to this website to apply for a grant? Just a meeting?
No.
Yeah, I was gonna say
That's
that,
the transparency, I mean, you
Yeah,
just say,
yeah.
well, I can't tell you what to apply for or how much, but go to the website and read the
yeah,
guidelines.
so, yeah,
Yeah.
I'm thinking that we need to clarify meeting and what they mean by technical assistance, and that be part of the, language that we submit.
Do we, I'm not sure. Is there an actual definition within this bill?
I didn't see it.
Yeah.
Yeah, I don't see,
But I think we just need to have a definition
Yeah.
of both.
meeting.
What you mean?
Yeah, and if we can just add, say we would like to add the definition of meeting and add the definition of technical assistance to the legislation. To clarify it.
Yeah,
that
maybe
we're not
that's a little bit
changing it.
more.
Yeah,
Yeah.
we're not changing it, we're just making it more easy for us to manage.
And so, yeah, I mean, we can do that and let's find out through Tish, because we also don't want them to create something if they don't have something established, when they could just say, oh, whatever you believe technical assistance is. And so that could also be something internally where, hey, we're gonna adopt this official definition of technical assistance, and I think that if we work within like those parameters of the actual powers of the board and say that's what we're gonna adopt, and then you go back, right, as long as we're working within that established process, I think that like that kind of solves the issue. But yeah, I guess I don't see one either, and so I'm not sure if we want to do that and be very specific. I'm not sure if if it is within like healthcare district codes. I'm not sure if we do have something like that. I don't think I've seen it either. But I mean, it's good. I don't know if,
But that's something that we can work with Tish on in her communication with the Senate. And I already have set up with Tish. It's not like, we haven't been doing the work with her. She's already had some preliminary communication with the author. She's asked for us to provide some proposed language modification and things to consider. So, I mean, I think it's certainly good for us to ask what is technical assistance, what's meeting, what defines meeting.
Yeah, and then clarification on 5, because even just you could keep that language, but just even put in a prohibition against individual meetings regarding submitted grant applications.
Once they're submitted, then it's okay to talk to them. It's more
Yeah,
like.
for
You, but not for us as board members, right?
Well,
For anybody.
for anybody, yeah.
Oh, okay.
Yeah.
Yeah, I just, to me, this is not really clear language.
Because
I think
we
it's,
do have grants that are in process that have not been submitted yet, so we have not received them, and then, so they can say, hey, you know, I'm writing a grant for $6 million, you think it'll fly?
Yeah.
And where, you know, in the past, we would say, I don't think so, I think maybe we're honing in on this, and but then maybe we'll give them a little bit more direction, which I don't see what's wrong with that. It's not like you're saying wink, wink, yeah, you
Right.
should apply, and ask for 5 million, you're just saying, oh, well, you know, it could be something we'll be interested in, but maybe 6 million might be too high, ask for.
Or
Yeah.
Cut it down,
Instead of
or
like,
try and just.
Yeah.
instead of doing 6, do 2, and I'll make sure that it's approved, right? Like those are
That's
the
what
conversations that
yeah,
you're trying to
exactly.
avoid.
Well, maybe our new attorney who's on the board of directors can help us formulate some language that we can submit to the legislature. I'd be happy to coordinate with her, and see what we might come up with about those two definitions and language. that might-
She's on here if you want.
The only
Yeah.
thing that I wouldn't want us to do,
That's right.
the only thing I wouldn't want us to do is create limiting ourselves more, right, instead of, so that could also be like the way forward, like, hey, let's establish what the technical assistance definition is, and then that might limit us, right? And so if at the moment we have the ability to either describe what that is, or create a definition for it that works for the district, right? I think that should be the route that we should go. Again, I know that we've had conversations with other healthcare districts, and doesn't seem to be too much of an issue because they don't fund such a like large scale that we do. But I mean, I'm all for building a coalition and see if we could move something like this forward, if we believe, and I think that's would be our intention. I'm not sure if we're in a position right now to actually take action, and it's not an action item, but if we, a recommendation, to, like, submit some sort of language, develop language and see what that would look like.
Can we present it to the next board meeting? Is that something the committee wanted to do once you approve it?
Well, I think I'd be coming back probably to the committee possibly in February.
Do we have time to do that?
So,
Is there?
there would still be,
Rush?
the
Yeah.
legislative cycle has like, committee deadlines, and
Exactly.
so I would say that if we can, maybe within the next couple of weeks, it's still somewhat early. But yeah, I think we need to look for an author and someone that could carry the bell.
Do you think Tish might be a little bit more successful if she went to the office and said, hey, you know, I got a healthcare district that it kind of wants just more clarification on the bill? So before we
done that?
No, I don't think
I
so.
had a preliminary conversation with one of their staff members, if I'm not mistaken.
And what is?
Yeah, like I've said a couple of times, is that she's waiting to give more of a detailed conversation with her, because it's been asked, okay, what is the district looking at? What would they like to see? And so that's where, you know, we've come to use the committee to determine in the discussion that we're having now. So, I mean, I can go back to Tish at this point and essentially, I would communicate at this point is that we're wanting to update our policy to include that we would like to discuss, you know, scope of work, or I'm sorry, concepts with external parties and incorporate that into our policy. That seem reasonable.
Yeah.
Because I think if we can, like we're saying, create our own definition in a sense, including it in our policy, then maybe that meets what we need to do. I think, like you're saying, we have
Yeah.
kind of different
Yeah,
interpretations.
I think if we do both, if we submit this language to the author, saying, you know, this is how we interpret our responsibility to follow this legislation that you introduced and incorporate it into our own policy and fly it by her. And if she thinks that it needs to be amended, then we ask Tish to introduce it.
So what I would recommend is let's create and see what like that, like adding a definition to technical assistance would be, because again, this is how I'm interpreting it, and this would, you know, we can ask our legal counsel and see if that's how he's interpreting, because at the end, like that's what matters, right? Because I mean, there could be many interpretations, but as long as we believe that that's like our legal
Yeah.
counsel.
Of course.
So if, again, because I think that the part that says, you know, that as long as we work within our established grant award process, I think that's what is keeping us safe, right? Like we provided our guidelines in the process and we are following it. I think that it's when we go out of it that that would be the issue. On the technical assistance part, I think that I would recommend that we do it internally. Especially if it's not too much of an issue to other healthcare districts, then I think that we should be fine with adding our own definition and then see how that's gonna be put into our grants award system. And then once we do that, I think typically, or what I've seen is, when a bill, which is now law, is not working, when you go to the author's office, they can actually say, well, this is what my intention was, and this is why I created the bill, and this is how we are interpreting it. And at that point, if our constituent is interpreting it differently, like that's not up to the legislator, right? Like you could take it up to the courts, you could go find out a way on how to make it work for you. So I think that for now, like if we're able to make it work for us and still be within, like following this bill, the rules, I think that we should be fine with that. A conversation with other healthcare districts and letting them know, like, hey, like, are you having issues, but like the technical assistant part or any part of the bill, or this part is specifically, and if it is something that is also affecting them, I think then for sure that would be, let's run a bill and get their support, right? And if it's something that they don't think that they can work on internally, but
So may I ask a question? So in the beginning, when we were first presenting this, I mentioned that I really don't have any problems with it as, you know, working with the grantees and the applicants. And I think the applicants understand and that they're okay with it. Is it on the board of directors side, are you seeing an issue?
so I know that there have been comments referring back to AB, like since I first got on the board, right? Like, oh, but we're limited because of AB 2019. And I kept hearing comments like, oh, the limitations because of AB 2019. And so I think that's why it came to be. And I remember saying or sharing some comments like, hey, I understand why the bill was created because there was some issues with some healthcare districts and like the LA area, and to try to avoid them funding their friends or going to their friend and be like, hey, I sit on the healthcare district board, you should go apply because we have money, right? I think that's very different than actually like
And
someone.
getting preferential treatment.
Mhm, because like, hey, you should vote for this application because they're our friends.
Mhm.
So I think that's very different. And so I remember early on saying, like, I understand the purpose, and I think we had a conversation at one of our was it governance meetings at I think we're at Fantasy, one of their conference rooms. I think we had brought this up. And so I said, how I see the bill, I see why it was created, and I agree with the author because I don't think that we should be going out and soliciting, right, or asking our friends or organizations that we work with, like, hey, you should come and ask for money and you'll get it, right? Like, I don't think, and so I guess fast forward going through 60, if it's not an issue, right, for staff, it's not actually creating limitation, then I don't think that we should actually, I don't think that we need to fix this or there's anything. I think for me, it was important, and as discussed in our last legislative meeting was, and Donnie mentioned, said, let's go over the bill, let's find out what it is that is not working and try to correct that. The section identified, I don't think it's too problematic because of what I've already stated. But I'll support if it's something that we believe staff would benefit from tweaking this bill or this law in running a bill, like I mentioned, that's what I like to do, so I'm all for it, but if it's not something that
Well,
we, you know.
I still think what Carol mentioned about getting clarification on what do you mean by meeting and what do you mean by
Mhm.
technical
Assistance,
assistance might be a
yeah.
little, and I thought just might be
Yeah.
the one-on-one sitting down with the
Well,
author.
and, you know, the wording, if the bill needs to be amended, you just say notwithstanding, this bill does not forbid, and
And I would,
lay it out.
yeah, and I would think that maybe she would behoove her just because she did this in
Exactly.
2018. Okay, so
Mhm.
now we're 7 years going into 8 years into it. Maybe do a little bit of research on our own, like, well, what's really happening with the healthcare districts? Are they adhering by? Are they having
Mhm.
problems with it? Or are the applicants complaining, you know,
Mhm.
calling up and
Well,
writing and stuff like
at an
that?
ACHD meeting, there was a presenter that talked about their grant process. And I asked her how she got around AB 2019, and she,
She's like, what?
yeah,
Yeah.
yeah,
What?
and, yeah. And I said, well, how do you get the word out? And she says, well, we just send out our constant contact mailing lists, the availability of grants, and this is how to do it.
And I think that within our grant process, I think it, and I can't remember if we have a policy before that we're on a communication policies and how we send the word out. I think as long as it's fair, right, and we're not just sending it to like 5 of our friends, I think as long as like we're sending it out to everyone is very different than going to just one person or to one organization, which is,
Right,
I think, what
and
this
we,
goes.
Which is what we do.
we do.
Yeah.
Yeah,
And my guess is that's what you're talking about too with the
Mhm.
other
Yeah,
district, that
there's
they're
a
sending,
broadcast.
Yeah.
broadcast out of. the
just like when we did the mental health initiative, we sent out the release and that there'll be the potential for.
Yeah, and a lot of times when we'll send out a news release about the last board meeting, this number of grants was approved.
Mhm.
By the way, you know, here's some
If you're
grants,
interested.
if you're interested, yeah,
To
so,
our
yeah.
strategic plan.
Yeah.
etc.
So I would agree with Kimberly that if it's not an issue for staff, I don't think there's a need. I still think we should get clarification though on.
But I just want staff members, I don't know if anybody else has had
Yeah.
a problem.
Yeah.
Just-
I think we should get
I kind of think it's a fail safe thing just to say, I'm sorry, we'll talk
Mhm.
about it, you know?
Yeah.
Yeah, I get asked out in the community about, concepts and it's just say, they even request meetings and they'll say, hey, what do you think about this? I said, well, we do have on our website all the information, so, maybe, not in the details or funding or anything like that, but just guiding them to where the appropriate information is.
Yeah.
And some folks do request a meeting and then you jump in the meeting and they're asking those details and I said, it's in the website.
Yeah.
So.
And so I'll follow up with Tish on that based on what we're talking
Okay.
here. And then, I've also, speaking of our legislators, I have met with Assemblymember Gonzalez and asked him specifically, because he's always asking, what can we do to help you? What can we do to help you? So I told him kind of what we're up against with this, and I asked if maybe, from like a legislative standpoint with, maybe some of their staff, if they could help us with some potential language that could be proposed or considered. Now, I haven't heard anything back.
Yeah.
I'll circle
Yeah.
back with them. But I wonder if we should be concerned if we were to decide to go to a separate legislator to propose something. Because I've discussed that with Tish as well, and she's like, I wouldn't recommend going to a separate legislator. And she said, I think it would be much better if we stay with Aguilar. And because she says in Sacramento, and you have better understanding of this, whether it's good to go.
Go behind the back and changing things.
Well, that's what I mean. I mean,
Yeah.
does that kind of create kind of a battleground?
Yeah.
Mhm. Yeah, that we don't want.
So, yeah, so for like the technical assistance and the definition of meeting, I would, one, consult with Jeff. Because I think that if we're okay with the definition that he gives us and the interpretation of the law, that we can and should follow that. If we want a definition from the author, they might be able to provide it, although I also know that sometimes bills are created in a way where they don't necessarily want to limit a district, right? Like I see maybe they just don't want to limit us completely. And if we go back, it's like, oh, really? You want it to be a little bit more stricter, right? So I don't know if we want to do that. And how I see it, right? As long as we are good and we have a definition from our legal counsel and we're following that. And then internally, if we want to modify, add, or correct any of our policies, I'm open for that too. Yes, on contacting Agia Curry's office first as a courtesy, right? And if they actually say like, we don't think that it should be modified, then we could leave it at that. And then if we determine that we believe that it should be modified, then we ask our locals and let them know this is what the modifications we believe should be. They have access to a legal counsel and attorneys that actually draft the language. So as long as I think that if we give them a good, paragraph or 2 paragraphs of the information and what the issue is, how we believe it could be solved, they should be able to draft the language and they'll do it not just for legislators, but for outsiders too. But I think that we can do that, or that could be, and legal counsel should have language. They don't take too long. So within maybe 2 weeks, and depending on the legislator's office and their relationship with legal counsel, they could sometimes get it within 2 days, 3 days. So, so those would be my recommendations moving forward.
And with regard to discussing with Jeff, which we will do, I mean, if we go back to when we were originally doing our policy, if I recall correctly, I think we were talking more along the lines of how we could meet with potential grantees and that, and Jeff squashed that, but it doesn't hurt to reconvene that conversation with him.
Mhm.
I think it's gonna be,
Is the committee okay with Director Smith and I working on a first draft?
So I would say let's hold off on it. And because again, if it's not gonna be like an issue, we won't need it. So it's just gonna be not redundant work, but work that we might not need. I am gonna say,
Well, we need some direction to go forward. So, and,
so
and
the recommendation was one to get
Our legal counsel.
legal counsel.
See about
And
contacting
Mhm.
them.
Agia Curry, running it by her, but first we need to determine if it's gonna be an issue. And then if we are gonna need to modify any of our policies. The other thing that I was gonna mention, maybe within our policy, we add something where like, hey, twice a year, we're gonna have some sort of not technical assistance, but information on our grants. And I can't remember if we've done this in the past, where it's like, even if you haven't applied, but you're interested, we're gonna give you an overview of what the process is, and we'll be able to answer any questions. And I think that's it's very different than just calling people up and like, hey, you're my friend, you should come and listen to this conversation. It's like, hey, we're inviting anyone that's interested in applying in the future, and we're gonna provide this information. And so I think that would keep us okay within the law.
Yeah,
and we've done that.
so it's kind of a good idea too, because we do notice, we could get even, assist NPO Centric to come along with us on that one, because we've seen some bad grant writing. And it's just like, maybe more one-on-one basics of how to write a grant, answer the question and stick to what we're asking, that sort of thing, whereas, a general thing, and then we can also talk about, and we've done this with our RFPs, we've had,
An
FAQs.
overview of it.
Yeah.
Yeah, and we do have that information on the website, like when we did the first, informational session.
Yeah.
And we do have a document, like the frequently asked questions that kind of guides the
Mhm.
grantees with that. So that's all in the grants tab as a resource.
So I'm just, looking for ways that we can actually not bypass the law, right, but be creative and see how we can do some of those senses. And then again, how I see it, right, if it's within our process, right, we're not working outside that scope. I think as long as it's, which I appreciate of AB 2019, right, because it still allows the healthcare districts to create, it's not them telling us this is what your your grants policy should be. It's, hey, go create a grants policy and just follow it, right? Just
Mhm.
follow your own rules. And so that's what I appreciate about this bill. Any other?
Is there a consensus amongst the committee for that direction?
Well, it's been a problem for what, 7 years, 6 years? And
You
we
think
have.
it's a problem.
Yeah, in terms of our ability to communicate with our grantees. And I think that we need to clarify the language,
The word meeting.
the word meeting and the word technical assistance. And pass that by the sponsoring legislator. That would be our first choice, but I think, does Jeff have a deep understanding of what we need legislation by legislative language?
So, and I don't think we've had conversations, but it hasn't been until like today that we've actually gone through or have the notes and actually have identified what those issues or potential or what we could see as issues, which at this point they are, but I don't think that they're like big issues. And I think that let's find out and try to get answers before we actually try to run a bill.
So what kind of issues you see, you've said it's been a problem for the last 2 years?
Oh, we only have 15 minutes left.
Oh, okay, sorry.
Yeah.
I was just wondering what for some of the.
Well,
What you thought.
yeah, it's just the inability to discuss the grant process with our grantees.
And you can discuss it with
Process.
No, I mean, but
Process,
have,
but-
to provide technical assistance to the grantees who are applying. And as you said, there's a lot of grantees that have very, yeah,
Yeah, but
they're,
I was just wondering what you.
yeah, I'm just saying the barriers that we face thus far. And there have been barriers.
So,
Okay, moving on.
alrighty, so any questions from staff going forward on this? We're good.
Thank you.
Alrighty, so next item, F new business, Tish is not able to make it. She did provide a legislative update. She also provided notes on, the Senate leadership team and like committee membership appointments. I know that she talked about that briefly where she thought that the, chair for the health committee was going to change, and if I'm not mistaken, and I read that correctly, it did change to Weber, Senator Weber. So now she's the new chair for health committee. And then also she included notes on the governor state of the state address. Committee members, do you have any questions on those?
No questions, but I'd like to highlight in the governor's state of the state that Riverside County was one of 3 that was identified as the largest homeless count drop. So, yeah,
Homeless count dropped?
Yeah.
Oh,
I think 19% in unsheltered, but we were mentioned on the stage by the only 3 counties, right?
fantastic.
Right.
Congratulations.
And as far as SB 588, I see that we need new language.
So
For the freestanding health
Mhm.
facility emergency.
So is it something that we want to continue moving forward? Understanding what some of those barriers were from the last time. I'm not sure if we've had communication with Senator Ochoa Bowles' office and see if there's interest from her in continuing this or moving
Yeah,
this bill.
I've had that discussion with her
Mhm.
staff and the answer is yeah.
So we can have an official yes from her and then also look in to see if on our end, if we want to see any modifications or we want to see it reintroduced in the same way where it's a pilot, not a pilot program, but a study. And if that's the case, if we want to move forward with the same language or let's determine if she has any suggestions in modifications before we move forward with this bill, understanding again, I'm hoping that we would no longer have the opposition from the physicians, but I believe that SEIU, we either have to have a very good conversation with them or else I believe that they'll remain in opposition and that's what's not gonna allow us to move this forward, in my opinion. And so, either have a good conversation with them and understand where they're coming from. I know that it has to do with like ratios, providers to patient ratios. And so understanding that, I know that at some point the state legislature could just say, and this is something that I spoke to with Senator Trump, well, in passing in one of the events, was also, hey, there might be they might just say, why don't you go pay for it? And so if that's what they would suggest for the healthcare district to pay for a study, that's something that we would have to determine, right? Like how much money we want to spend on it. But I wouldn't want to move forward within that route unless we have some sort of pledge from the legislature saying that they're gonna actually not respect, but that they'll actually take the information of the study provided in order to move something along. Because I would hate for us to pay for something, or I would even hate for the state to pay for something that they're not gonna do with anything. For this.
And I think there's the potential to bring SEIU on board for this part of it, because it is just a study.
Mhm.
And in those conversations with them, it's like part of that study will be, what's the impact to labor? What are the concerns that you have? How can we address those within that study? Because I think that's the way to get them to at least not oppose it in a hard way.
Because we
And the
didn't have.
environment, and the environment that we're in with Palo Verde Hospital in terms of looking at them for closing, that a freestanding emergency department would be something that would be desperately needed there, just to serve the community.
And
But we
because-
can get one there.
Hmm.
Oh, well, they.
I'm just saying, yeah, I was saying, if there were enabling legislation,
Yeah.
that they could certainly have one. And we certainly have deserts of unserved people out in the East Valley and even Desert Hot Springs. Twice this year, we had a lengthy closure of both highways into Palm Springs to get to our trauma center. So, you know, we need, Desert Hot Springs needs a freestanding emergency department, and I'm sure you'll hear it.
And if we do decide to, or the author, because I guess it's not our decision or choice, if the author does decide to move this forward, let's try to just garner support from not just the local, but other areas in close proximity that are, you know, within Democratic leadership as well, because I think that could take us a step further. Unfortunately, the hearing, there weren't many questions asked of the bill. I think it seemed like they had all made up their mind, or SEIU or the Doctors Association really did beat us to it, where I think they all kind of made their mind up that, hey, this is not something that we wanna move forward. And so let's just find out from her office, get an official yes, and then that way we can like work on it a little bit more in details and include, like Greg mentioned, labor, right, and other stakeholders that.
Well, I think one of them, the groups that was opposed to was like the Association of Emergency Physicians or some organization. like that.
Yeah, and I'm sure Dr. Kumar is on board and would be able to help.
And so one of the, because you always have like the back conversations, right? One of the things that I heard that when we had submitted this bill, that it was kind of like, what's their problem? Like, why are they even going there? Right? And so we're gonna do this. Let's just be, smart and very strategic in how we're gonna do it, right? Because if we don't want another bill where it's like everybody's gonna be afraid, not afraid of it, but like they don't want to touch it because of opposition, right? And so what's gonna happen? Our bill might just die in committee if it even gets heard. So I guess the first step would be contacting Senator Trusco office, get an actual confirmation from them, and then next steps as well. Like from there, we'll take their guidance to see what like their bill package is gonna look like, and if this is not gonna be a priority bill for them, then we're gonna have to put in a little bit more work. Any other committee member comments? Have a few minutes, any questions, staff, any questions, you, any public comments at this moment?
Yes.
Go ahead. If you could please state your name.
Yeah, I'm
Thank you.
Thank you. My name is Jax Kelly. I live in Palm Springs, and I just wanted to say, thank you for putting together this committee. I understand this is a new committee for the health district, so I actually serve on a couple of different committees, all of them involving aging. My particular focus is on aging and HIV. But I just want to offer my assistance on a couple of things that I do. I just came from the morning meeting of the Riverside County Advisory Council on Aging, which I serve on. There's the Aging and HIV Institute, which I just gave you the card for, which does advocacy for. And then also a community group called Let's Kick Ass Palm Springs, where it's ASS stands for AIDS Survivor Syndrome. And we just celebrated our 10th anniversary and was recognized by the county for it. So I just want to offer my help because I understand in some organizations, they look for community input as well as support when it comes to letter writing, which my organizations have all been involved with at some point or another. If, especially on issues regarding aging or HIV, I just wanted to introduce myself and just offer. So thank you for having me.
Thank you.
Yes,
Thank you.
we'll hope you'll attend future meetings.
We are having community forums starting next month.
I understand that,
Public
yes,
strategic
yeah,
plan.
so
We'll attend.
I'm looking forward to putting it on my calendar. I don't think that, has the dates been set?
Yeah.
Okay.
We're on
We're
our
on our
website.
Instagram.
We're on our
Facebook.
website.
Yeah,
Are they on our website?
yeah, on our Instagram and our Facebook. But I can get you a copy of the flyer if you'd like before you leave.
That's fine.
Actually, I have written.
You have one, Andrew? Okay.
And Jack's welcome and thank you for joining us. In your interest in this committee, for you and to everybody out there listening. Don't, for you to send us, if you're coming across any legislation that you believe would be important for like the health district to support or maybe oppose, right? Or that we should be informed, send it our way, right? So that way we can understand. I think just background in work for state legislature. And so that's something that I would always emphasize within our community. Come talk to us, right? Because sometimes we're busy with our 20 bills, right? But then there's many other things going on that we don't get to hear, that maybe in our eyes is not that important as those on the ground or those going through it. So I think it's important that, if there's something that you believe that, hey, the healthcare district should know about this, right? Or there's a piece of legislation that's going through and it's gonna affect our community and we need opposition on it, like send it our way.
Is there a mailing list or an address that I could send it to directly? Because I do periodically send out messages.
So, I'll have our
You have
CEO
info.
give you.
Well, info@dhcd.org.
Do you want a card?
Do you work with Jeff Taylor? Phil?
Hmm?
You work with Jeff Taylor?
Well, he's a community partner, so yeah.
Well, with that, I'm gonna go ahead and adjourn the meeting at 3:57. Give you 3 minutes. Everyone.
Good job.
Nice to meet you. Thank you.
Thanks for joining us. Have a good afternoon. We'll see you at 5, Director Smith. Thanks, Dr. Kumar.